disc repair cervical. This is a endoscopic transdiscal approach to treat herniated discs for neck pain and arm symptoms. Our patient has neck pain and right arm pain with radiculopathy. We are now placing our first needle through the skin on the left side into the C5-C6 disc. I need a better shot than that. For some reason, you're still way overexposed. I need to bring the exposure down so I can see the individual bones and discs. We've got C2 at the top, 3, 4, 5, 6. I believe we're at 5, 6. Now she has a fusion at C6, 7 already. Come on, Jordan. It's a little bit better, but still we could do better. You need to collimate more, or you need to reduce the exposure, or something. I need to be able to see those individual discs. All right, this patient has 2 discs that are going to be repaired today. C5-6 and C4-5. Do we have the MRI up? While you're playing around with that,
yes, sir.
look at the MRI. Roll. Other way. All right. Very good. So, well, I see C2 at the top. Space 3, space 4, space 5, space 6. So we're at C5-6. You agree, Luis? We're going to do our discogram. Jordan, if you can get a better picture, it'd be appreciated. I don't know what you can do, but I still feel we're a little bit overexposed. Shot. I need a shoulder pull. Shot. I got it. All right. Well. Yeah. Shot. Shot. All right, it's good. It's definitely leaking out everywhere. You see the amount of rotation of the head compared to the fluoro? Do you see that C3 pedicles? It's like your orbit is totally off for some reason. Shot. That's even worse. There's definitely scoliosis. That seems to be better, but you think you have to go more. Shot. I mean, we're fine at 5, 6, but when you get up to 3, 4, there's horrible rotate. There, that's better. Whatever you did. She's got some pretty bad scoliosis. Rotational abnormality. That's better. That's better. That's much better. 2, 3, 4, 5, 6. I agree. Everyone agrees. We are in the proper 5-6 disc. That's the bottom one. Everyone agree? And we have an AP. Let's get an AP. Oops. So we've got a lateral x-ray. We need an AP x-ray. We're using the x-ray to navigate to the disc that we want to fix. Yeah, you can see it in there, the dye. That's good. Go back to a lateral. At this point now, we're going to introduce the guide wire, and then along the guide wire, the dilator. I'm going to make a small incision in the skin. Shot. And her biggest issue is really the arm. She's got 2 issues, and this is worth understanding. She has a shoulder problem on the right side, which clearly we're not doing shoulder surgery. She'll need that treated later, but she also needs her spine fixed because she has herniated discs that are pinching the nerves, causing narrowing of the neural foramen. And the narrowing is happening on the right side, knife, at C5-6 and C4-5. The incision here for the Deuk laser disc repair is a 4 millimeter incision. So it's really small. How's blood pressure?
102/54.
Thank you. It's perfect, basically. There's our 4mm incision, folks. Right there. We're going to do the whole surgery through that incision. So, Luis, I was thinking, let's get a little shoulder pull. This 5-6 is severely collapsed. Can you give us some inline tension, inline distraction? Shot? Shot? Oh, looks good. Just hold there, guys. Shot. Guide wires in. We're good. Everybody agree we're at 5-6? Stay where you are there. I'm going to bring the dilator down. This is the dilator. Shot. All right, so we're coming down to the number 5-6. Shot. Getting to the front of the spine. Shot. I can feel the front of the spine. Shot. Perfect. Right there. Let's get an AP. Relax, everybody, relax. Coker. So, on the lateral view, it's perfect. 2, 3, 4, 5, 6. On the AP view, let's check again. So far, everything's been looking good on the AP. That looks really good. So you can see how twisted the spine is, but we're literally pretty much in the midline, which is good. Take that. Raytech. What I anticipate based on the MRI for this disc is that the disc itself is pretty collapsed. And I need a little inline traction to get this dilator down. Inline traction. Shot. All right. So I'm going to try to work this dilator through the front of the disc, at least to get it started. Then I can remove the guide wire, because the guide wire just is really, its job is to get me down to the disc. Getting into the disc is hard because it's such a scarred up disc. It's got a lot of scar tissue inside the disc. That's good. All right, so I'm going to take this out. I'm ready for the mallet. Shot. Now we're actually passing through a jelly-like disc. Shot. Uh-huh. Shot. We're at the back now of that disc, and I think that looks pretty good. Luis, what do you think? All right. So we've now passed the needle first, then the guide wire, then the dilator, and we are using a tiny little cut. It's 4mm. How do I know? Because the outside of this tube is 4mm wide. It's the diameter of 4mm. So the incision is around 4 to 5mm. Did you get more tubes?
Yeah.
Because
We need more.
I think we're going to need more after today. So
No. Once say we need traction now. Ready? Okay,
yeah, we're going to do some traction. Just yet. Wait, not yet. I'll tell you when. But yeah, we do need traction. So I'm bringing this tube that we're going to do the entire surgery through, this little 4mm wide tube, and we're chuckling a little bit because we got good muscle relaxation. Because we've already gone through a few of these tubes lately, because we've had a lot of patients that have really collapsed discs that are scarred together. The bones are scarred together. So they don't want to open up and distract open. I got this. All right, so we're going to try to advance the tube through. Luis, and I was thinking, Shot, that we should have a company make this outer, pull hard, this outer tube. Shot, that's good. It's feeling good. Yeah. We're almost there. Shot.
I like the calls on there. Huh? The calls is good on
Hold on, relax for a second. All right. So the problem is, as we do this, it hits the little metal things right here as we're trying to drive the tube in, and that damages those things. And we've talked about different ways to deal with it. It's got a sharp end, that's why. But maybe we
Put
can.
that down there like that with a hole on it. Yeah.
Why not? Maybe that'll help.
I think so.
This is
Well, I need a
Dr.
little buffer.
Dr. Burndes' idea. So I'll give him credit where credit is due. Hold on. And I think we need a design, Luis, of a of one of these that it's got a lateral.
Fairly mechanical. My dad was an engineer.
I think that's probably as good as we're gonna get right there. So let's see what we've got. I think we need a tube here that is designed to come up, and instead of having this fluid adapter connection, it kind of has this parts that flare out like a handle that I could turn, and that we could hammer it in easier.
So it has a sleeve, like a sleeve.
Yeah, and like a reinforced area at the top.
Right.
Who could design that for
I
us?
talked before with a company called ASAP, and they actually do this stuff.
So let's talk to an engineer there and have them.
I probably need to send one of those, and
You need to send one of these.
I can send one.
Yeah, send a damaged one.
Yeah.
And that's what we need, though, is that type of a tube. But instead of this little things here, tines, we need a solid so we can impact it in. And we need like a handle that comes off so I can twist it and pull it out. Does that make sense?
Yes, sir. That's a good idea. Should I remove it for now, sir, or wait until the fluid adapter's on?
Not yet.
Or you can slide the handle right at the top.
I would just leave it where you can leave the fluoro right now, right?
Like that?
Why not?
Should be fine.
It's gonna get in the way. I think
No,
it's
no, no,
fine.
should be
Let's
fine.
try.
Yeah, yeah.
Oh,
Can
the
we-
drainage
that-
bag.
That, I mean, that, yeah, something
Just
is-
fell down,
yeah,
sorry.
I got it.
I think the drainage is the only issue, right? Is that gonna work?
I can move it so like this. Here. Yep. Is that okay for you?
You're fine. Yeah. Okay. We're gonna bring our scope in next, and we have a laser that we're using to zap away the herniation. And we're gonna turn the scope on. We're gonna start our irrigation. Is our suction? How's our suction doing? All right, heading down to the bottom. So we need to fix the focus. There we go. And we're ready to get started. 20? Where's my pedal? Oh, I got it.
You can slip one of those Mayfield knobs that we just unloosened.
Yeah.
And slip it so it slips right on.
Yep.
And then you can also hammer it. You can hammer the knob and squeeze the knob.
Hey, listen. You and Louise start working on this.
Okay.
Ooh,
Yeah.
don't move that. Because, what is that? You and Louise start working on it?
Right.
Because I'm going to be gone for a few weeks.
Okay.
That would be a great thing to work on. See that, Luis? See the flashing? What do you think that is? We're getting good delivery of energy down at the tip. Alright, so this is just the very beginning, and we have the same scenario every time where there's very little movement allowed by the disc because of the extensive scarring that's going on inside the disc. And the reason why there's so much flashing is I think we have a lot of calcium and bone spur. But I think there may be something else going on. I don't see anything with the laser fiber. Sometimes if the integrity of the fiber is compromised, you might have some side flashing. Alright, I think we're okay. Seems to be alright. lot of calcium deposits in here. A lot.
Rita, can we turn out these lights, please? Thank you.
Oh. The other name for calcium deposits is bone spurs. Clearly see there's a lot of bone spur here at this level. How are we doing on irrigation? Did Crystal have to leave? Huh? Why are we out of irrigation already? Oh. Is there a problem with the pump? Luis, you need to get another pump.
We have 5 pumps. And
5 now?
working. Yeah, they're working fine.
Huh? Oh, the other ones are noisy? Why don't we have Right Way look at them and fix them? I can't do anything without irrigation. I'm not getting any. All right, there we go. All right. So, Kevin, why don't you show our audience the reason why discs cause pain in the neck because of the tear that's in the back of the disc called the annular tear. That's what we discovered at Deuk Spine Institute. And of course, the Deuk laser disc repair is designed to treat that tear.
Traumatic injury on the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissue develops within the annular tear, causing neck pain. The inflamed annular tear generates pain signals. Additional injuries can cause worsening symptoms. Inflammation from the annular tear can spread to the nearby nerve roots, causing arm pain. Pain signals travel up the nerves to the brain, causing localized neck pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of neck pain. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.
Thank you. Welcome back. Right now we're at the C5-6 disc and I'm working on repairing this disc, and I can tell you, boy, there is a lot of bone spur here. Horrible, horrible bone spur. It's really stuck, and it's coming along, but just very slow, and that's fine. I don't have a problem with slow. I have a problem with no, but not slow. You like that? And you can see the amount of movement we're starting to get here. It's really getting better. You doing all right over there, Rita? All right. So you can see the tube is starting to move now, whereas when we first started there was absolutely no movement. It was just encased in scar tissue and bone spur. So we're going to keep going and just flipping back and forth as we loosen it up. Try to make some progress.
Rita, could you give me a chance to check my IV? Feels like it's
IV?
my IV feels kinked.
You what?
IV's not full.
Yeah, let's get on the IV. You need help, Rita?
It's in the AC, right?
Are you happy with it? Is it not functioning?
Yeah,
Huh?
it's not working well. Look at the video. Yeah, it's better now. Was it a kink or something? Or? It feels like it's kinked or bent or something. The way it's injecting, it doesn't feel under a lot of pressure. Now it's better, whatever you're doing there. Keep doing what you're doing. Put a little traction or some tape on it. You want some tape? Okay, there's some tape here. Yep. Tape it where you have it. Tape it. All right. Thank you very much.
This is a lot of scar tissue here from chronic inflammation at the back of this disc. Wow. See this white stuff here, right there, is all scar tissue. This stuff here is osteophyte. There's some junk in the foramen there. Coming back. What I mean by junk is a lot of inflammatory tissue, scar tissue, a little bit of disc herniation, bone spur, thickened ligament. Ligaments are normal structures that hold bones together, but unfortunately as you get older they get lax and they start to thicken. The joints get lax, the ligaments thicken to try to hold the joint together. So ligaments respond by getting thicker and stronger, but that ends up pressing on nerves. So you don't want that. Thickened ligaments cause what's called spinal stenosis. And spinal stenosis pushes on nerves, and the spinal cord causes damage to the nerves and spinal cord. So it's your body's way of trying to stabilize the joints. We're going to do this disc and then we're going to head up to the next one at C4-5. I'm not seeing a whole lot of herniation. I'm just seeing more bone spur and scar tissue. A lot of stenosis, cleaning it out. My goal here is to get the pressure off that nerve root as much as I can. All scar tissue. Bone spur here. I gotta be honest, one of the worst cases I've seen. What do you think, Luis? This disc has been injured for a long time. And that's one of the problems with fusion is if you don't do the fusion just right, it puts a lot of stress on the discs above and below. And then that can actually cause the discs above and below to wear down faster, which then results in more degenerative disc. There's some herniation on the other side.
This calls for the big fiber.
No,
Yeah.
the big fiber, it won't fit. Yeah.
Neither for the. You can only use it lumbar, right? The big fiber. It's only
Yeah.
one place you can use it.
Yeah. No, this is finesse work. Yeah. Just about done with this disc. We're going to move on to the next one. This is all herniated disc that's been scarred up, calcified. It's pretty bad. Like I said, this disc is amazing how severe it is. This injury to me looks like it's at least 20 years old. Are we irrigation stopped? All right, thank you. So one thing you might have noticed is that there's not a lot of dye, the blue dye that we normally get. And the reason is because there's not a lot of degenerated disc. There's not a lot of nucleus pulposus left. It's all gone. Because the nucleus, once it gets damaged, it really starts to dissolve away, but it takes time. That just gives you an indication how long this has been going on. For a very long time. All right, and I've done as much as I can safely. It's just so stiff, you know? So stiff. That looks good though. Scope off.
Please. Lights on, please.
It's as much as I can get. The rest is just down to the dura, and it's just scar tissue and bone spur. So I think that's going to be good. We're just using a little antiseptic and irrigating it out. All right. Now we're going to have to move everything north. What I mean by north is towards the head, one disc. So first thing I'm going to do is I need to get the fluoro in shot. I'm going to take out the retractor and leave the dilator. Then I'm going to have to march this dilator up in just a minute, but I want to apply a little pressure in case we have any venous bleeding. So I'm going to bring this dilator out of this disc and move it up. So you can see the next disc is the 4-5 disc. I know it's hard to see and I apologize, but there's not much I can do about it. That's just her anatomy. Her anatomy is such that it's really hard to see because the way her spine is twisted. Hold on, Luis, relax. All right, good. All right, so 2, 3, 4, 5, 6. Everybody agree 4-5 is next? All right, so I'm going to come out, shot, pretty much out there, okay, shot, we're right in the front of the spine, relax a little bit, give me an AP, I need to see where we are. All right, so we're a little bit off to the patient's right. I'm going to come back towards me. Shot. Perfect. Lateral. So I'm going to make my way. You can see how the spine twists off to my side, right? You see all that scoliosis? And look at the bone spurs on the sides. My God. Point to those bone spurs. Oh. Huh? That's all right. We're going to go AP again. Huh? Did you see him? Yeah. A lot of arthritis. Huh? Scoliosis?
DJD is to contribute to that? Or?
You know, the scoliosis contributes, but the DJD shot contributes to the scoliosis.
That would make sense, yeah. One hand washes the other.
AP? Yeah, one causes, it's a vicious cycle.
Right.
The DJD causes the scoliosis, which then makes the DJD worse. Shot. All right, so you show them those huge bone spurs. Yes, 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 and the one above. Massive. Those are ginormous bone spurs in the facet joints.
Inflammatory wear and tear.
Yeah, inflammatory wear and tear. Go lateral. All right, so I'm trying to make my way up to the next disc. We're going to fix this. We may need to be treating those facets. I don't think she has a lot of facet pain, but we're going to see how she's doing afterwards. A lot of patients end up needing additional treatment of their facet joints after their disc surgery. Shot, but she definitely needs the disc surgery. Shot. AP. And shot. A little too far to the other side. I'm going to bring it back to my side. hold on. And shot. A lateral, that's really good on the AP. If only we're over the disc on the lateral, then we'll be fine. Oh, that's perfect. Mallet. Shot. So we're going into the 4-5. Shot. Remember, we're fixing 2 discs here. Please don't try this at home. Shot. Have you rolled the video shot on how the laser surgery works, Kevin? Shot?
No, sir, not yet.
Let's do that. Let's show everyone how Deuk laser disc repair works.
Of chronic neck pain. The inflamed annular tear causes neck pain. Inflammation of the nerve roots causes arm pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. It can take up to 12 months. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deuks.
Okay, we have just advanced the dilator, and for those of you can see, she's bleeding blue, red, white, and blue. Very patriotic. We're bringing this tube down, and this tube is going to go through the disc and get to the back of the disc where the herniation is. And it's going to allow me to work through that tube to clean up the herniation. You can see I brought the dilator all the way back right where the tear is. Hopefully you all had a chance to see the tear a minute ago. Much better tear seen on this one than on the last one. Shot. Wonder if we should try our technique of cushioning. What do you think, Luis? Why not? What? Do you have that other one that had a hole? No? This? I think that's it, right? Yeah. It looks like a bullet hole or something. Yeah. We're trying to cushion the impact a little bit on the actual equipment. Go ahead. To see if this helps. And this was again Dr. Burndes' idea. Shot. So here we go. Shot. Mm-hmm. Oh, good. I'm glad you are. What is like? You're like with a one finger in line.
No, it's good.
Shot.
I got pretty strong hands.
All right, that looks really pretty good. Let me get it just a little further. Shot. If I can get another millimeter, that would be even better. Everything is millimeters in this business, by the way. In case you're not understanding, I mean, we're literally talking about spaces that are just a few millimeters wide, or that should do it. That's as good as I can get it. All right. Shot. All right, you can move that fluoro out now. Thank you. This will be the second disc and our last disc that we're doing. This is the top This is the C4-C5. Now, this disc happens to be less scarred than the last one, but it's still pretty substantial. So just because it's less, on a scale of 1 to 10, it's about a 7.5. The last one was a 10. Nah. Nah. Yep. So let's go back down the rabbit hole. And here we are at the back of the disc, right where the herniation is. I think this one is going to be the more important herniation for her. There's a piece of herniation right there. So different than the last disc already. You can see that. I'm going to try to grab that out. The last disc was more degenerated, more advanced damage. This one is less degenerated. There you go. Got to keep the pathologist happy and keep their children fed. Right, Rita? You agree? We need 15 minutes. We'll be closed. So you enjoying the area then, Space Coast?
Yeah, I love it. I like it here.
Yeah, good. Well, you said love it, then you said like it. I don't know which one. You like the bridges?
I really am still learning my way around a little bit too. You know, it's been only a couple of weeks. But yeah, I like all the bridges and the outer islands and stuff. We don't have that in Boca. You know, when you go to the coast, you don't have a bridge. You just have the intercoastal waterway. That's it.
Yeah. I think this is definitely going to be, of the two discs, this is going to be the worst. Now, there's a lot of scar tissue still here, right there. But there's also fresh herniation, fresh nucleus. So this is, I think, going to be the disc that causes more of her symptoms.
So you know you have that rubber tube that goes over the syringe.
Yeah, I was thinking about that too.
Why don't we make that rubber tube slide
little
down,
bit,
make it out of metal, so you
open
can turn
that,
it. So you can turn it, then you put the sheath over the flange. So over the flange, then you hit the rubber tube.
Yeah, I was thinking about it just right now.
Plastic
Honestly.
made, make it metal. That's how it works.
I love it, guys.
And then you can use it to spin it too, and you have the same diameter. Tell them to get the metallurgist just to make it that same diameter and drop it down about a ½ inch, and then
And it can be done sterilely? Sterilely?
it's all going to be one piece of metal.
Wow, that's great. My gosh, what is, that's like a giant herniation right there. Calcified.
I'm going to show it to you when you're done. I got it right in my mind how it would work.
All right.
And then you have the handle too, and you can rotate it and pull it out.
You know, I'm impressed. I love it. I feel like this is the A team of the OR right here. This is my A team.
Handpicked by you.
That's a giant bone spur right there, just digging in. The actual disc is here.
You can see
Little-
the laser working harder on this case. Seems
Yeah.
to be working harder. Right?
Yeah, sure is. There's a herniation right there, you see it? Oh, it's a big one right there. That's the one. I bet you that's the main one, and it's ugly. I think I can grab it. It's too big for the laser. I mean, the laser will eventually get it, but it might take an hour. No, let's see. Nothing. I feel it. That might have gotten a little piece of it. Let's see what we got.
That piece looked a little color changed from the dye, maybe. I don't know. It looked a little blue.
I think we got some of it. There's a little bit left here. Right there.
We got a question from YouTube.
Are you saying something, Kevin?
Yeah, we got a question from
yeah,
YouTube.
your voice is so low we can barely hear you. You sound like a little mouse. Can you bring up the mic on your end a little?
We got a question from YouTube.
Yeah, it's still really low. I think you need to go up higher, and you're really crackly. I thought Troy fixed that. Am I taking what?
Are you taking away bone right
a lay
now?
bone? I don't understand. A lay bone?
Away.
Oh, away bone. I'm taking away bone spurs. Bone spurs are not supposed to be here. They're growths. They're growths that crowd around the nerves. Oh, look at the radiation. There it is. Wow. That's it. Bam, right off the nerve. That's it. You see that thing wiggle itself out of the foramen with this laser? Incredible. Yes, we're taking away bone spurs that are growing off the vertebrae and pushing on the nerves. Well, it's not that big, but it's in just the right place to cause problems. So, yeah. We don't take normal bone away with this surgery. We only take abnormal bone spurs away. So I watched a really good program on Netflix. Anyone interested? It's about the this. I've heard about this thing that happened back in the 70s, back in Sudan, where there were these Ethiopian Jews that were being persecuted by in their country. There was genocide going on. And the Mossad, which is the Israeli Special Forces, they set up a plan to get all the Ethiopian Jews out of Ethiopia and Sudan because they were coming to Sudan to escape. Of course, Sudan wasn't nice to them either. And they set up a dive shop, a Red Sea diving shop, and it was really a dive shop full of secret agents for the Israeli military. And at night they would take these Ethiopians that were refugees basically fleeing their country to avoid being killed. They were taking them and putting them on boats at night and getting them back to Israel. So saving their lives. And they did this for a few years successfully and saved thousands of Ethiopian Jews from being slaughtered. It's on Netflix. It's if you have Netflix. Red Sea Dive Shop or something like that, or Red Sea Dive Resort. It's pretty ingenious. Eventually they got caught, and I don't know how true it is, but apparently the CIA got them out just in time. Helped them out, Pretty cool story.
We got another question.
Sure.
How long is the waiting list to receive this operation?
The waiting list is short because we believe in not making people wait. So we do everything we can to get people in within a week or two if they want it done quickly. You just have to talk to Joe. Joe does all the scheduling. And honestly, if you're thinking about having the surgery, then I would fill out the MRI review. Why don't you do the MRI review form for them, Kevin, and let them give that address there so anybody that wants to have a free MRI review can get it done.
How to request a free MRI review. Who are we and what we do? With world-class physicians on staff, the newest and most advanced technology, Deuk Spine Institute has performed thousands of procedures and achieves a 95% success rate in elimination of pain. Treatments? Every patient comes to us with a unique set of challenges. That's why we address every patient's care individually. These are some of the world-class treatment options available at Deuk Spine Institute. Deuk laser disc repair, Deuk spinal fusion, rhizotomy, epidural injection, kyphoplasty, physical therapy. Meet Dr. Deuk, world-renowned board-certified neurosurgeon. Go to www.mri.deukspine.com. Click the Free MRI Review tab on the upper right. Complete the patient information form. Continue to fill out Step 2 of the form. Make sure to submit all your MRI images, plus report. You can submit the MRI through the mail, file upload, or medical record release. You can drag and drop or upload images into the form. Things to remember when submitting your free MRI review. All MRI images must be submitted along with the report in order for it to be reviewed. Once your case is reviewed by our team, a patient advocate will contact you. Thanks for choosing Deuk Spine Institute.
All right, well, thanks for sharing that. And as you can see, Deuk Spine Institute does do free MRI reviews. We do that because we want to help people from around the world understand what is wrong with their spine. And you don't have to live with neck pain and back pain anymore. We can solve the reason why you have it, and we can fix it. We're able to fix about 98% of back and neck pain. And I can tell you right now, not all of it can be fixed with Deuk laser disc repair, but the disc pain can. If you have a herniated disc and you're having pain from the herniated disc, that can be fixed with the Deuk laser disc repair. All right, we are done here, fortunately for her. She gets to wake up, and I think she's going to do great. She'll take about an hour to recover, and then we're going to send her home after an hour. This recovery is a 1-hour recovery. Let's move all this over. Here you go. And I'm going to show you why it's a 1-hour recovery. It's a 1-hour recovery because we got a great anesthesiologist. That's number one. If you have a not so great anesthesiologist, the recovery tends to be a lot longer. And then it's also a 1-hour recovery because the incision is 4 millimeters. I'm going to show you that incision in just a minute. You want to zoom in on the incision?
Yes, sir.
All right. I'm just holding pressure for a moment. Tell me when you're ready, and I'll show you the incision.
Ready to go.
All right. There it is. Can you guys see that?
Yes, sir.
That little cut right there? These are my big sausage fingers, and that's a 4 millimeter incision. So the whole surgery was done through that one little cut. No metal is put in, no fusion is done, no artificial discs, No need for any of that nonsense. This is all natural. Go in with the laser, debride the annular tear, remove the herniated fragments. We decompress the nerve and spinal cord when needed. And the most important thing is to clean up the annular tear so that it'll heal itself. All right, you guys ready? We're all done. Thank you, everyone. Great job. Luis, phenomenal. Everyone, Dr. Burndas, wonderful. Go ahead and... Oh, we got some feedback coming on the speakers in the OR. It's weird. I'll head over there and I'll answer any questions. Go ahead and type up your questions, folks. Good morning, I'm Dr. Deukmedjian. I'm here with one of my patients, and you traveled to Deuk Spine Institute here in Florida from where?
New York, Poughkeepsie, New York.
Awesome. And why did you come from New York to Deuk Spine here in Florida?
Because I heard that this was the best place for me to go.
What kind of problems were you having that you needed to come here?
I had lower back problems and numbness in my leg, which was my left leg. This was the best place for me to come.
Okay, so you had back pain, sciatica down your left leg, pain shooting down the left leg.
Yes.
And that was just yesterday, right? When you
yes,
had
that's
that.
correct. Yeah.
And what, do you still have your back pain today?
No more back pain.
It's gone.
Go on.
And is that because we have you doped up on powerful painkillers?
Nope, none
No, it
whatsoever.
isn't. Did anybody in New York offer you spine surgery to fix your back?
Yep, yes they did.
Yeah.
And they wanted to fuse it.
Yeah. And you've had surgery before. You had a microdiscectomy, and that helped you for a little while,
Yes,
but the symptoms came back.
came back.
Yeah. All right, well, they're not going to come back this time. So what do we do to make your pain go away?
You fixed my back. I did arthroscopic.
That's right, arthroscopic spine surgery called the Deuk laser disc repair. So leg pain's gone, back pain's gone.
Everything is gone.
You happy?
You did. Very happy.
You're smiling.
Yeah, I tell you.
Congratulations.
Thank you so much.
We did it all through a 7mm incision, just that big. And you can actually watch that video right here, an animation, to see what it looks like to do the Deuk laser disc repair.
A Band-Aid sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own.
So now that your surgery's done, what are you going to do?
I'm going to go home and enjoy my life.
Good for you.
Enjoy my life.
Congratulations.
I am very happy.
Anything you want to tell your viewers?
Other than this is the place to come, it's worth the travel.
Dr. Ara Deukmedjian here at Deuk Spine Institute. It's Groundhog Day, I believe, right? February 2nd, so 2/2/2022. And I'm here with one of my patients who traveled from, where did you come from?
Tennessee.
Tennessee. And Why would you travel from Tennessee to Florida to Deuk Spine Institute?
I have been miserable for months, and I found you and did a consult with you and knew this is where I needed to come for good treatment and relief.
And what kind of problem were you having that brought you to Deuk Spine Institute?
Severe lower back pain, which turned into sciatica, and it was down my left leg constantly. I slept about 2-3 hours a night at most, and I could not sit for more than 5 minutes, and I had to be standing up.
And did you try some other treatments in Tennessee or elsewhere?
I did. When this whole thing started and it was a bad flare, I thought I'll be able to work through this. Chiropractic, physical therapy, 2 spinal injections, massage therapy.
And how did you know those treatments did not work for you?
I had no relief at all. My sleeping continued to get worse, and my pain was never better.
And do you have relief now?
Absolutely. I would say I have 95% relief.
Awesome.
And it's amazing. After surgery yesterday, I put on a back brace. I walked out of here. I sat down yesterday for probably over an hour and had lunch. Last night, in bed, I had 0 pain. It's a miracle.
Well, we're very happy that you're doing so well. And your surgery was a great one because we fixed 2 discs. You had herniated disc at L45, L5S1, and you can see in this footage right here that we grabbed the herniation out, and it was one of the herniations was really big, and it was really gratifying to get it off because it was resting on your sciatic nerve. Once we took it out, I think your sciatic nerve probably felt a sigh of relief.
Yes, absolutely.
Yeah, and the surgery went very well. The laser debridement of the annulus went well, and I feel like your pain's going to be gone. It's not going to come back.
I would agree.
All right, very good. Well, is there anything else you want to tell your viewers?
Folks, if you're suffering and you're not getting relief from those non-invasive therapies, then come see Dr. Deuk and have him look at your MRI and give a good diagnosis. And if you need to have surgery, you come down here. He will take good care of you, and so will his team.
I really appreciate that. Thank you so much.
Thank you.
I'm Dr. Ara Deukmedjian. It's January 26, 2022, and I'm here with one of my patients who you underwent the Deuk laser disc repair on your lower back for some herniated discs about a week ago.
Yes,
How are you feeling today?
unbelievable. For almost 3 years, I had lower back pain, and it just, it just nags at you, wears you out. And then I came here, and you were the first one. I went to 2 other surgeons, and neither one of them picked up what was wrong with me, even though I had the MRI. And you came in, and you told me exactly what was going on, and you performed the laser surgery, and I'm like a different person.
Yeah.
A week later.
Yeah, you were a different person the next day, right? The day after, you had no pain, remember?
No, absolutely.
Yeah, so that pain's gone for the rest of your life. How does that make you feel?
New life.
Good. And, a long time ago, remember when people did something great, you say, what are you going to do now? They say, I'm going to Disneyland. You already went, I can see.
No, my wife's a big Disneyland fan.
Good for you. All right, so sounds like we helped you with your back pain, and it sounds like you're very satisfied.
Oh yeah, I'm recommending a friend of mine in Connecticut to come here. You have to come here. If you go anywhere else, I really think you're going to be wasting your time. So this guy just looks at you, and he can tell what needs to be done. He's a fantastic talent, and I'm very grateful that I came here.
Well, we're grateful you did too, because it's going to change your life for the better. Congratulations.
Thank you, Doc.
You're welcome. Good morning, I'm Dr. Deukmedjian. I'm here with one of my patients, and you traveled to Deuk Spine Institute here in Florida from where?
New York, Poughkeepsie, New York.
Awesome. And why did you come from New York to Deuk Spine here in Florida?
Because I heard that this was the best place for me to go.
What kind of problems were you having that you needed to come here?
I had lower back problems and numbness in my leg, which was my left leg. This was the best place for me to come.
Okay. So you had back pain, sciatica down your left leg, pain shooting down the left leg,
Yes.
and that was just yesterday, right? When you
Yes,
had
that's
that.
correct. Yeah.
And what do you still have your back pain today?
No more back pain.
It's gone.
Go on.
And is that because we have you doped up on powerful painkillers?
Nope. None
No, it
whatsoever.
isn't. Did anybody in New York offer you spine surgery to fix your back?
Yep. Yes, they did.
Yeah.
And they wanted to fuse it.
Yeah. And you've had surgery before. You had a microdiscectomy, and that helped you for a little while,
Yes.
but the symptoms came back.
Came back.
Yeah. All right. Well, they're not going to come back this time. So what do we do to make your pain go away?
You fixed my back. I did arthroscopic.
That's right. Arthroscopic spine surgery called the Deuk laser disc repair. So leg pain's gone, back pain's gone.
Everything is gone.
You happy?
You did. Very happy.
You're smiling.
Yeah. I tell you.
Congratulations.
Thank you so much.
We did it all through a 7mm incision, just that big. And you can actually watch that video right here, an animation, to see what it looks like to do the Deuk laser disc repair.
A Band-Aid sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own.
So now that your surgery's done, what are you going to do?
I'm going to go home and enjoy my life.
Good for you.
Enjoy my life.
Congratulations.
I'm very happy.
Anything you want to tell your viewers?
Other than this is the place to come, it's worth the travel.
Disc herniations are a common cause of chronic neck pain.
Hi, Dr. Deukmedjian here, and we're just finishing with 2-level cervical Deuk laser disc repair. As you can see from the MRI scan right over here to my side, there are 2 red arrows indicating herniations at C4-5 and C5-6. Below the bottom arrow is, you can see a fusion at C6-7, which she had over 20 years ago without metal, without plates, and she's developed adjacent segment disease as a result of the fusion and probably the primary injury, because when I got into that disc at 5-6, it looked like it had been damaged at least 20, 25, 30 years ago. There was so much scar tissue and bone spur in there. That disc, I did what I could, but it was actually the one above, the top disc, that I got the most done on. And there was some herniations in the foramen on the right side that popped out of the foramen with the assistance of the laser. And if you go back and watch that, you can actually see some pretty big herniations coming out of the crack. The crack obviously being where the nerve is and spinal cord is. So I'm hoping that that did it for her and she's going to have a great result. Her primary issue is her neck pain going down her arm, and she also has a shoulder issue, several shoulders issues. So we've diagnosed those as well with her being here, getting an MRI scan. Those were missed by her other doctors. So quite often we see patients who come here who have kind of pain going down the arm and shoulder, and they end up having a shoulder injury plus a neck injury. That was the case here. So we fixed her neck problem. Now she's going to need to have a shoulder injury addressed. That said, the surgery went well, didn't have any complications. We lost very little blood. The whole surgery was done through a 4mm incision. I know we have a question from our audience.
Yeah, I have different levels of this. C5, C6, C7, C8, and I have pain extending from my radial and my ring finger all the way below my armpits. I also have pain near my scapula and upper spine. Would you be able to do all those levels in the same surgery?
So somebody's saying I've got a lot of herniated discs in my neck and I've got lots of symptoms in my arm, down in my ring finger and my pinky. So the neck has a lot of bones, 6 and basically, sorry, 7 bones, and there are discs in between the bones. That's what these are. So they're saying I've got multiple discs, and can you fix them all at the same time? Usually we can, but it's going to depend on your anatomy. And the kind of things that I have to look for is, for example, the jaw on an x-ray view. Is the jaw low? Is the C3-4 disc up behind the jaw? The jaw's blocking access to it. The clavicle is another thing, the collarbone. If the neck is short and the collarbone's high, then I can't get down to the bottom disc. And then there's the girth of the actual neck itself. So somebody with a really thick neck, like a football neck, it's really hard for me to get down and feel the spine. So there are a lot of anatomical constraints that I have to take into consideration before I can tell you if I can fix all the discs at the same time. Ideally, we would try to do that in one surgery. I've done 4 discs before, and I'm able to do that as long as the anatomy allows it. That would be my answer. So the best way to figure that out is to do a free MRI review. We have a link at www.mri.deukspine.com. So mri.deukspine.com, and if you go there, you can upload your MRI, and I'll take a look at it, and then we'll do a video conference, and I'll have a better idea of how many discs I can fix in one sitting.
That's it.
That was our only question. Thanks for joining us, and I hope you enjoyed the live broadcast for educational purposes from Deuk Spine Institute. We are the only facility in the world broadcasting all of our surgeries live, and we've been broadcasting them live for the last 9 years, 8.5, 9 years now. And these are all spine surgeries that we're broadcasting live, whether they're fusions or endoscopic surgery or otherwise. Hope you enjoy the broadcast and learn something. We'll be back in 2 days for our surgeries on Thursday, where we have a few laser surgeries as well. And we have 3 of them. So see